Hip arthritis is very common, first of all, and it is also something that creates a lot of disability for patients who have it. Let me take a step back and kind of explain what arthritis is in general a little bit. That way we can apply it to hip arthritis. First of all, we're going to talk about osteoarthritis. There's a few different kinds of arthritis that patients can have. Osteoarthritis is not the presence of something in a joint. It's actually the loss of something in a joint. So a lot of times patients will come to clinic and they'll say, well, I had a knee scope and they scraped the arthritis out. Well, I don't really know if that's exactly how it works, because when you have osteoarthritis, what happens is, because of things like lifestyle or age or inflammation, the cartilage changes in its composition. So the protein structure of the cartilage changes, and the cartilage content of water will increase as we age. And effectively, that creates a brittleness to the cartilage that allows it to fissure and erode away. And as the cartilage erodes away, that's when patients get arthritis. Arthritis, as it progresses, is changes within the bone. The bone reacts to the arthritis and the inflammation that patients have because of arthritis. And the bone, it reacts by forming little bone spurs, and it reacts by forming little cysts below the cartilage that fill with fluid. And those are all things that show up on an X-ray, and we can see that. As the cartilage goes away, the space between the two bearing surfaces in the joint gets smaller. So the cartilage is what holds in the hip. It's a ball in a socket. So as you lose cartilage, the ball in the socket, the bone part comes closer together. And once they touch, that's what we call bone-on-bone arthritis. So that process of loss of cartilage in the hip is what hip arthritis is. As arthritis progresses, it becomes more and more inflammatory, and the inflammation within the joint causes other things besides the cartilage and the bone to change as well. So the synovium, or the lining inside the joint, becomes hypervascular, and the tissues around the joint, like the capsule, which is kind of like the balloon that the joint lives in, and all the little ligaments within that capsule, those become thicker and they get stiffer. So the range of motion that the patient has in the hip goes down as well. So inflammation creates pain, and inflammation creates stiffness. And then once it becomes advanced, then the patient doesn't have the range of motion in the hip to be able to reach their foot anymore. It makes it very difficult to complete tasks of daily living, even as simple as clipping your toenails. And the pain that patients feel as a result of hip arthritis is disabling, and it makes it very difficult for them to have a normal level of activity. The symptoms of arthritis in the hip are basically pain and stiffness. Which one comes first kind of depends on the patient. Sometimes people will come to clinic with hip arthritis that is fairly early stage, and they'll notice the pain from the arthritis first. Other times people will notice that their hip doesn't move the same way that it used to, and they're having trouble doing certain things. Walking, standing for long periods of time, reaching their foot for self-care to put shoes and socks on, or being able to walk long distances, navigate stairs or uneven ground. Some people will come in complaining that they can't climb ladders. It kind of varies from person to person how exactly it presents. But ultimately, it's always pain in the hip and associated stiffness that makes it hard to do things. The pain from hip arthritis typically is in the groin, and a lot of times it'll also radiate into the thigh, especially the inner thigh. Sometimes it can even be felt in the knee or right behind the buttock. One of the things that I do with my patients to kind of help them describe what they feel is I tell them to put their hand in the shape of a C, and then put it on their body, right on their upper outer hip. And if that's kind of where the pain is, then there's a good chance that it's because of arthritis. We diagnose arthritis of the hip much the same as we diagnose any musculoskeletal condition. It all starts with a history. Typically, after we're done hearing the story of any given patient, we're about 90% sure what we're looking at. And then we do a physical exam, and then a lot of times we get an x-ray. And in the case of arthritis, an x-ray is probably all we need because we'll be able to see that on the x-ray. The story usually goes something like, I've been having this pain in my hip for a couple of years. It started out no big deal, and over the last year, 6 months, it's really started to get a lot worse. And I've noticed that the pain is right in my groin and over here on the side, and it makes it hard for me to do things. I feel like my hip is stiff, and it's hard for me to stand long enough to do what I want to do, and it's really hard for me to reach my foot. I have trouble cleaning my foot and putting my shoes on. On the physical exam of a patient who has hip arthritis, they really have very little range of motion. We typically lose flexion of the hip, which is bringing your knee up to your chest, and internal rotation of the hip, which is if you turn your toes in, if you point your toes inward, you're internally rotating your hip. Those are the two things that typically go first. And the worse the disease gets, then the stiffer and stiffer the patient's hip gets. On the x-ray, what we see is narrowing of the joint space. So on an x-ray, you can see the ball in the socket, and you can see the thigh bone and the hip bone, the big pelvis bone. And what you can't see on an x-ray is cartilage, because cartilage is invisible to an x-ray. The x-rays go right through it, so it doesn't show up. But when you have space between the two bones of a joint, if that space is wide open, you can infer that the cartilage in that space is intact. So as those two joint surfaces approach one another, as the bones get closer together, that means that the cartilage is going away. As the cartilage gradually goes away, other things happen within that joint as well. The bone on the x-ray turns more white. That's something that we call sclerosis. That represents a reactive change in the bone that's just under the cartilage. The other thing that happens is your body will form bone spurs around the joint. So at the rim of the socket or around the bottom of the ball in the hip joint, there are little bone spurs that show up on the x-ray. The bone spurs themselves are not necessarily the problem. They're the result of the problem. The other thing that happens is in the bone right under the cartilage, you can see little circles, or almost like little soap bubbles forming, that we call cysts. And those cysts are reactive changes in the bone as well. And they're little pockets that can fill with fluid. They form for a couple of reasons, mainly inflammation, also because if there's no cartilage over the bone there, then that allows your normal joint fluid to get in there. So that shows up as a little fluid-filled cavity. Treatments for hip arthritis. There are a lot of ways that hip arthritis can be treated non-operatively, mainly with injections. Injections are a way to relieve inflammation and to treat pain. They don't do anything to reverse the process. There's not really a whole lot out there that can reverse the process of arthritis. And in that way, it's kind of a one-way street. But the itis in arthritis means inflammation. So in order to treat the symptoms, we have various different ways of treating the inflammation. One of those ways is to inject the hip with a steroid. And we could do that right in clinic. We just use an ultrasound and do it. It's real fast, and it works right away. And the steroid that we inject into the hip acts to decrease inflammation and hopefully decrease the patient's pain. It can't really do a whole lot for range of motion, so that's where PT comes in. So if the patient has a hip that's getting stiffer, then we can send the patient to PT for exercises that strengthen the muscles around the joint and also increase the range of motion by stretching out those thickened capsule and ligaments and synovium around that inflamed joint. Medications that work for arthritis, obviously there's Tylenol. And Tylenol is pretty safe. It's over the counter. We see a lot of patients that take Tylenol on their own before they ever get to clinic. But the mainstay of medication for arthritis really revolves around the anti-inflammatory medications. And over the counter, those are medications like ibuprofen or naproxen. There are several other ones, and there are prescription level anti-inflammatories as well. But ultimately, arthritis is an inflammatory condition. So if we can decrease the inflammation, we can decrease the symptoms. Total hip replacement or a total hip arthroplasty is my favorite procedure. It's my favorite procedure to do, and it's my favorite procedure because of what it can do for my patients. For a certain subset of patients with arthritis, the disease process gets so bad that we lose the ability to effectively treat it non-operatively, and for those patients, a total hip is a great option. When you have hip arthritis, you lose the cartilage within your hip, and the arthritis creates inflammation within the joint that leads to pain and stiffness and inability to live the life that you want to live. And in that situation, a total hip arthroplasty is able to rid the patient of that arthritis and replace their joint or their bearing surface with a new, smooth, good functioning bearing surface. And what we do in order to replace someone's hip, what I do is I use an anterior approach, which lets the patient recover a little quicker. And it also lets me be more muscle sparing and soft tissue friendly. And I go between the muscles, so I don't cut any of them, I go between them. And then I enter the hip joint and I remove the arthritic ball of the ball and socket. And then I prepare the socket by taking away that bone that contains the cartilage where the arthritis is. And then I put in, usually it's a press fit, I press fit in a new socket. And then that socket is made out of usually titanium. And the socket holds a high-tech plastic liner that has really good wear characteristics. And then we focus on the thigh bone, the femur. And I prepare the femur by machining it to accept a stem, which is it acts like a fence post to hold up the new ball and support it. And then the stem goes into the femur. It's also press fit. And then on that stem, I put a ceramic ball, and the ceramic has really good wear characteristics as well. And then articulate the ball into the socket. And then after surgery, when the patient wakes up, they can bear weight immediately. And because of the way that the implants are designed and the fact that they're press fit in, the patient's bone grows and attaches to that implant and makes that implant part of that patient. And that provides good long-term fixation. At JIS, we focus on rapid recovery post-op. And when I say post-op, what I really mean is the whole episode of surgery, because rapid recovery starts way before surgery. So at the time when patients are first seen in clinic and we decide that surgery is the right way for them to go, they go through a preoperative process where we optimize any medical conditions they may or may not have to ensure that those aren't going to be problematic in the perioperative period. And what that looks like is to take care on the front end of anything that could lead to delays in the patient's recovery on the back end. So then when the patient gets to surgery, it can be done as an outpatient. All of the things that we need to take care of are already taken care of. So we do the patient's surgery. There's a lot of things that happen the day of surgery that helps us with our rapid recovery protocol as well. And that starts as soon as the patient gets to the surgery center. So before surgery, the patient's given oral preparations of pain medications, and then during surgery. So on the day of surgery, there's a lot of things that happen that help us with rapid recovery as well. When you get to the center, you'll meet the staff at the center, and then they will help you get ready for surgery. And then before surgery, typically we give you several oral formulations of pain medications that is part of a multi-modality pain approach. And that helps alleviate pain both during and after surgery. Then the anesthesia team comes, and typically with a total hip replacement, we do that surgery under a spinal. And the spinal anesthesia is helping us with our rapid recovery as well, because basically, if you're asleep under general anesthesia, you still feel pain, you're just asleep. And that pain can blaze a trail. But if that pain is stopped by spinal anesthesia, then it can't blaze a trail, and it leads to better post-op pain management. And also it makes the surgery a little safer and a little easier. We still anesthetize the patient, but we can keep the anesthesia a little bit lighter, and the patients wake up easier. Then we control anything post-operatively like nausea and vomiting before the patient's released from the surgery center. As a post-op pain protocol, we use an oral multimodal pain approach. And the way I used to kind of describe that to patients is kind of like the four ninjas approach. So they're all fighting one enemy, and this enemy is the pain. But there's four different ninjas fighting the pain from different angles. So rapid recovery extends into the post-operative period as well. And one of the things that helps with rapid recovery is actually the outpatient discharge. Not only do patients love the outpatient discharge, but it also, in a way, life is therapy. So sure, we do physical therapy. Routinely we'll do it for about a month post-op, but it's also therapy to get up and get to the therapy visit, to walk through the parking lot to the therapy, to walk back and then go home. And it's also therapy to get yourself up within your home environment and help with your own post-op care. So that helps with rapid recovery as well.